Welcome to Adapt and Class. If you keep mixing up contact, droplet, airborne precaution, this video will simplify it in a very short time. I'm going to give you mnemonic, and by the end of this video, you learn the mnemonic to identify isolation precaution in nursing using the fundamentals I'm going to lay down. Before that, let's look at this question. This is the way the question will be asked. A nurse is caring for a client who has Clostridium difficile. Which of the following infections control actions by the nurse is appropriate? Wear non-sterile surgical mask, wear disposable gown, wear sterile surgical gloves, initiate single-use dedicated non-critical equipment, keep door closed, and then don the gown in the client's room. Put down your answer in the comment, explain yourself. In less than 20 minutes, I'm going to give you all the content you need to answer using 3 mnemonics and how to identify them. First thing, fundamentals of the infectious control principle. This is something you got to write down, put it down. And this is what the problem. We have different kind of isolation precaution. There is 2 types. We have standard precaution and then transmission-based precaution. What is standard precaution? This is all the thing you do for every client in order to prevent infection. It's standard. But transmission-based precaution is what extra step you take to prevent that organism that the individual have doesn't come to you and you don't transfer it to anybody. Therefore, if the NCLEX asks you a question regarding infectious control, they're asking you about transmission-based precaution. What are the constituents of transmission-based precaution? We have airborne precaution, we have droplet precaution, and we have contact precaution. Why do you have 3 names? It's because of the way the organism is transferred from one place to another and the size of the organism. Contact, you got to be closer. Droplet, you got to be within a certain distance because the organism has to go into there. And the airborne, it does not matter how far you are from the patient, it can get to you. These are the 3 transmission-based precautions the NCLEX or nursing school is going to ask you. Now, what do you do when you talk about transmission-based precaution? You do a lot of stuff. Steps taken to prevent the spread of infection. Sometimes you wear N95 masks. Sometimes you have to wear normal surgical masks. Sometimes you got to put the patient in the negative pressure room. These are things you do. You have to wash your hands or use hand sanitizer. You may keep the door closed, or you have to definitely keep the door closed. And then you may have to institute single-use equipment. These are steps taken specifically to prevent infection. And this is what we call transmission-based precaution in terms of isolation precaution. Now, we're going to take each one of them, and I'm going to give you mnemonic, and I want you to write it down. First, you have to know that airborne precaution, the mnemonic, write it down. MTV, this is the way to remember them, but put S at the end, MTVS, because of the organism that is involved. What are the M and the T and the V and S? These are the organisms. The M is measles, called Rubeola. T is TB, pulmonary tuberculosis. V is varicella or chickenpox. S is smallpox and SARS virus. These are the 4 or 5 organisms you should master for the airborne precaution. The next thing they will ask you, and so what? Ask yourself, what do I do when I have a patient with the airborne precaution? This is what you do. Don't add anything, don't subtract anything. This is all you need. This is the concept they're asking you to test you whether you understand. Don't bring any other isolation precaution, especially the standard. The nurse needs to wear N95, respiratory mask. You have to be fitted. Then when patient does not wear anything, the only time the patient wears something is when they leave their negative pressure room and they wear a surgical mask when they're outside, going to get X-ray, walking outside. The negative pressure room is designed to prevent infection from spreading outside. The door must be closed at all times. You cannot leave it open. You have no choice. The main door is closed. There's a secondary door that you can use to enter into the client's room, but the main door is closed. This is all you need for airborne precaution. I try to make things simple as much as possible, and that is Adapt NCLEX content simplicity. Now, let's take varicella and chickenpox, because there is a little things you have to know. They test you when they asking you about varicella and chickenpox, highly tested on the NCLEX and nursing school. So the first thing I want you to know is if you have active varicella or chickenpox with all the rash, what do you think? We know it's airborne, but because the vesicles contain what? Viral infection, and you have all those vesicles, which is active varicella and chickenpox, you have to institute airborne in addition to a wound contact. That's all. Airborne and contact. 2, active varicella and chickenpox. If they use the word open and non-crusted varicella, open means the vesicles are broken and then the individual is shedding the virus. That's a problem. An open varicella or chickenpox is active infection, and non-crusted is also active infection. Therefore, you consider it as varicella or chickenpox in active stage, carrying the virus, and therefore airborne and contact. Write it down. Watch this video multiple times to master this. This is what they keep on asking multiple times to confuse people. Intentionally making this video to help you master this infectious control. You may see a question regarding shingles or herpes zoster. Sit back. Sit back. Don't worry. Shingles means you had previous infection of varicella, which is now dormant and now has been activated because probably you are older or you are immunocompromised. There's 2 ways you can see it. If it's localized, small area of your body, and it's open, right? That means you're sharing some virus, and it's non-crusted. Since it's a shingles, we consider it as an infectious process since it's what? Localized and open and crusted. That means you can share the virus. What you do is contact precaution. You don't need an airborne because it's not an active infection in terms of whether it's a varicella. It's just a shingle. So remember, a shingles that is localized, that is open and non-crusted is contact. But if they give you the same shingles and they say it localized, it's now closed, that means it has been crusted. There's no fluid in it. You can just cover it or just initiate standard precaution. It's for information. If you master it, you golden. And the last one is the biggest. What is the last one? They will give you somebody who has leukemia, who is getting who's getting chemotherapy or immunocompromised. They will use the word disseminated. That means it has spread everywhere. Spread everywhere, immunocompromised. That means, and you get shingles, you consider it as active varicella or chickenpox infection. And what is active varicella and chickenpox? You need airborne and contact. 5 mnemonics, 5 content area regarding varicella and chickenpox that you will see on the NCLEX or nursing school. Now, let's get to Droplet. The organism has to fly and land somewhere. So I call it what? SPIDERMAN. It has to fly and land somewhere. It can't stay in the air forever. And it's spelled SPIDERMAN. What does that mean? The S is anything that starts with S most of the time. Strep, staph, scarlet, they all cause respiratory problem. They are droplet. The P is pertussis, pneumonia, parvo B19, right? And the I, you can use anything you want, right? But most common one is what? Influenza or H influenza or para influenza. These are the most common. They will ask you on the NCLEX. So master them. D is diphtheria. We have cutaneous diphtheria, which is skin, therefore is contact, and we have pulmonary diphtheria. This is just lung problem, therefore is droplet. The pericarditis, you know, is a respiratory problem. Rubella, we'll come back to this. You know, we saw rubeola and rubella. Rubella is what? Droplet. M is mumps, mycoplasma, meningitis. AN, which is adenovirus, watch that. It's very important. It has more than droplet. So for droplet, write down SPIDERMAN. That's your mnemonic. Nancy mnemonic. Isolation precaution. SPIDERMAN. And these are the common organisms they will ask you on your test. Now, what do you do then? And so what? Ask yourself, this is all you need. Don't add anything. Don't subtract. The nurse wear non-sterile surgical masks when he or she going to see the patient in the room. Patient is in the private room. You can put two together, cohort them, but most of the time in a single room, the patient alone. You don't need negative pressure room. You just need a private room. The client does not wear anything unless they live in their private room and working outside or getting X-ray. They need to wear non-sterile surgical masks. That's all. The door can be kept open, so it does not need to be closed. So the word you want, the adjective is what? May. The door may be closed, not close the door. That's a wrong answer. If you pick a close the door, I know the door needs to be closed, but not absolutely close it. Maybe close. And this is droplet. I told you about adenovirus. It's both droplet and contact. So you have to initiate droplet precaution and contact precaution. What is contact precaution? This is contact precaution. It's the biggest because there's a lot of organism. What do? This is the mnemonic. Mrs. Way Herpes. I use this to summarize every organism out there. You don't want to memorize all the names of the organism, but this is the most simplest way they'll ask you on the NCLEX or nursing school. What is that? Mrs. Way Herpes. The M is what? MRSA. You know, it's a skin infection. But what is the thing? They can ask you multi-drug resistant organism like VRE, that's vancomycin, ESBL. These are all organisms that need a bunch of big drugs to take care of them. When you hear that, those are our contacts. RSV and rotavirus is the RS is skin wound. When they give you question, patient has a wound and you have no clue what kind of organism causing the wound, assume it to be contact. That's why the W is the wound. Even sacral DQ is a contact precaution. E is the biggest. E is the biggest that I've heard from people. They see organism, they ask them, what do you do? And they have no clue. Use the word enteric and think about it. Does this organism causes diarrhea? If it causes diarrhea, it's enteric, GI tract. Put contact precaution. Shigella, C. diff. Everybody know about C. diff, norovirus, Salmonella, E. coli, all the things that will cause diarrhea is what? Enteric. Other E is your eyes, which is conjunctivitis. H is herpes, HSV, I impetigo, right? They have unencrusted lesion on their mouth. And the P, pediculosis, this is lice. And the S is scabies. These are common organisms you will see on the NCLEX or nursing school or any nursing exams, whether ATI or HESI. This is what you need to master that. Now, ask yourself, what do I need then? What are the PPE? That's what they're going to ask you. What are the most common PPE I need? Number one, remember, you need a private room, single room for the patient. You need to use single-use equipment. It's contact precaution. You need to wear a gown and the gloves, right? The patient does not do that. You need to wear those PPE before you get to the room. So you don the PPE outside the client's room. And then you remove them inside the client's room and you perform your hand hygiene. If you need additional PPE, you have to consider if there's going to be splash in your face. Therefore, if you're changing the wound, you're washing the wound, then you can add additional PPE. But if they give you a contact precaution question and you don't pick only gown and gloves for the nurse doing a routine care, please count yourself wrong, because that's not needed. All you need is the gown and the gloves. I really want to emphasize, because this is what I've been seeing. Infectious control is big on the NCLEX. People are not doing well because of over selection of answers. So this video, if you're having issues, this is for you. Now, and hygiene is the way they will trap you, because there's a bunch of information there that you may get confused. Everybody will pick one answer, but there's one specific one I want to focus on. You have two options: hand sanitizers. What do you use it for? You can use it for airborne, you can use it for droplet, and you can use it for most contact precaution. The word is most contact precaution, but all droplet and all airborne. The other option for hand hygiene is to wash your hands and water, soap and water. Therefore, which one do I use it? Remember, it's mostly for contact precaution. Washing your hands is mostly for contact precaution. Therefore, if you see airborne precaution and you pick washing your hand, you're wrong. You got to pick hand sanitizer. The only time you pick washing your hands, soap and water is for contact, but not all contact. It's for these guys: C. diff, rotavirus, scabies, and norovirus. I want you to memorize them. And when you see them, pick an answer regarding hand hygiene, soap and water. If you pick hand sanitizer, it's wrong. So don't forget about them. What do you think? These are the key aspects of contact precaution and hand hygiene strategy. Now, NCLEX tips. This is where I want you to write it down. If you have a question, put it in the comment. Look, most questions, they will ask you, ignore standard precaution, unless they ask you about standard precaution. Most, if you see isolation precaution, they're asking you about transmission-based precaution. And what are you looking for? Focus on the transmission-based precaution. What does that mean? Don't over-select. If it's airborne, you need, your PPE is N95. And the rest of the things you would do, extra steps you would do to prevent infection. This is the key. Don't over-select. Don't over-select. And remember, most PPE are for you, the nurse, not the patient. Unless the patient is leaving their room, they may need a surgical mask, but that's the key. Now, let's look at the two organisms we talk about, Rubella and Rubeola. They can be confusing, therefore expect them to test you on it. We know Rubella and we know Rubeola. How do you know whether one is airborne or one is droplet? This is the last mnemonic I want you to know. And this is the way I remember them. A bell alarm, what does it do? It's going to drop. So bell, drop means droplet. I see Rubella, which is the bell, is going to drop, and therefore it becomes droplet precaution. However, Rubeola, the last one is Ola. Olala. Olala means I'm waving you. Wave in the air. If you wave in the air, you are airborne. So Rubeola is airborne. Rubella is droplet. If you have another way to remember them, you can put it in the comments so that we can all learn. I will read it, and next time I'll use it in my video. So Rubella, you drop in the bell, droplet. Rubeola, you're saying oh la la in the air, is airborne. Now, let's look at our question. And then she's caring for a client who has Clostridium difficile infection. Which of the following infectious control action by the nurse are appropriate? Wear non-sterile surgical mask, wear disposable gown, wear sterile surgical gloves, initiate single-use dedicated non-critical equipment, keep door closed, and then don the gown in the client room. The way to approach infectious control question is first read and see what kind of organism they're giving you. C. diff. That's all. What will you do? That's all. Don't worry about it. Two things. You select or apply. You don't have to pick everything. Ask yourself, what does C. diff for? Is it what? Contact precaution. If it's a contact, what is the nurse going to do? That's all. That means anytime you touch the patient, you got to protect yourself. Why would you need a surgical mask? I'm not touching you, right? My face is not touching you. It's usually my body and my hand. Therefore, I don't need to cover my face. Don't pick it. Wear disposable gown. Yes, my body will touch you. My hands will touch you. I need to wear that. Gloves, fine, but there's a word there, sterile gloves. That means you got to look at all the answer and make sure there's no trap there. I put it there. Wear sterile surgical gloves. You need gloves, but you don't need a sterile one. Therefore, it's wrong. Initiate single-use dedicated equipment. Anything that touches the patient is infected. Therefore, single-use is good. Keep the door closed. The door does not need to be closed, right? Therefore, it may be closed. Don the gown in the client's room. The client's room is infected. If you wear the gown in the client's room or the gloves, it's infected. It has to be worn outside. Therefore, this is wrong. Only two answers are right. What is your score? Did you get this answer right? If not, watch the video again. Pay attention to the strategy. This is Adaptant Place trying to make this infectious control, isolation precaution fundamentals to help you master them. In terms of how to approach them using mnemonics that you will never forget. If the video helped you, put down a comment and let me know. If you have a good mnemonic, you can put it down so that we all learn. Take care of yourself and thank you for watching. Subscribe for more contents like that and good luck in your exams.